Now, the UK's failure to do more to stop COVID spreading early in the pandemic was apparently one of the country's worst public health failures, according to a report by MPs. Yes, indeed. Apparently, the government approach, backed by its scientists, was to try to manage the situation and, in effect, achieve herd immunity by infection. However, apparently this has led to a delay in introducing the first lockdown, potentially costing thousands of lives. This according to the MP's report. So what is the truth of it? Did we lock down too late? Might lives have been saved? Or is the myth of the early lockdown thesis just that? And do lockdowns work at all? Should they be deployed later this year if cases rise? Well, to debate this, I'm delighted to welcome a very old friend of mine, Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School. Bharat, great to have you back. And another pal, Dr. Anthony Hinton, a retired NHS consultant surgeon of 30 years' experience. And still with me, my panellist on tonight's show, journalist and author of the best-selling book on the COVID-19 pandemic, A State of Fear, Laura Dodsworth. Bharat, can I start with you? Do you agree with MPs who suggested that the Prime Minister and SAGE waited too long to enter lockdown?
You know I do, and I've been mentioning this and asking for early intervention since it arrived on our shores. So we're going back to January 2020. Now, remember, I am not in the business of holding people captive, keeping them under almost confinement to their homes, etc. Never been my desire. However, in the absence of other control measures, we needed restrictions. But the most important point is this. If we had acted early, if we had acted extensively, we would have been in a better place. And the better place equals fewer deaths, the economy not trashed, and not the stop-start that we've had serially as a result of allowing the infection to take hold in the first instance extensively before we acted.
Bharat, there was a peer-reviewed study that suggested that cases were falling before each of the 3 national lockdowns. Are you persuaded by that report?
No, I'm not, because what I need to point out is when you have got circulating virus in the community, it becomes very difficult to control. So whilst your case numbers may be flickering up and down as they do, the key point is you have got a lot of community infection, you have got a lot of community viral activity, and then it becomes very difficult to maintain control, etc. And the parliamentary, the 6th report from the Parliamentary Select Committee says exactly what I have been saying since January 2020.
Dr. Anthony Hinton is with us as well, a retired NHS consultant surgeon of 30 years' experience. Dr. Hinton, what's your view? Do you think lives would have been saved if we had acted more swiftly at the start of the pandemic, which is the view of Bharat Pankhania?
No, I don't think it would have made any difference at all. And in fact, there was a very interesting story today that seemed to suggest that the meeting where it was decided to lock down included Boris Johnson, Dominic Cummings, and Dominic Cummings' mate, a chap called Mark Warner, who's a physicist and, it appears, a part-time epidemiologist. Chris Whitty, the Chief Medical Officer, and Sir Patrick Vallance, the Chief Scientific Officer, were not at that meeting. Britain had a perfectly good pandemic plan. And if you remember the very first press conference that they all gave, it was about squashing the sombrero, keeping the figures low enough so that the NHS could cope, but allowing healthy people to catch COVID and so gain some herd immunity. Very similar to what happened in Sweden. And tellingly, if you look at the MP's report, there is an illustration in there, which is a map of Europe. And most of the countries in Europe are labelled on that map. One label is missing, which is Sweden. There seems to have been no discussion of what happened to Sweden. It's like people are just burying their head in the sand.
Dr. Pancania, you are, of course, a clinical lecturer at the University of Exeter Medical School. You're a data man, a numbers man, an expert in your field. Do you think that Sweden is a useful control in the experiment? And what do you conclude from the trajectory of the virus in Sweden?
Number one, if you look at the outcome for Sweden, it is not rosy. And people like Dr. Hinton, Mr. Hinton, love to bring up Sweden all the time. But if you really look at the totality of the picture for Sweden, it is not rosy, not at all. I must make this clear. We are not in the business of holding people in captivity in their homes. That is not our aim. But in the absence of any other control measure, what can you do? And just to make that extra point, if Prime Minister Johnson and Dominic Cummings and one other person made that decision, it is a failure of government, right? It is a failure of government to be making decisions on the hoof when you've already got procedures, processes for how you make those decisions. But that decision needed to have been made a lot earlier. We would have been in a better place had they made that decision earlier.
Laura Dodsworth, what's your view about this? Because it was obviously a time of emotion, really, I suppose, early in the pandemic, and you could forgive politicians and public health policy individuals. You could cut them some slack. They didn't know about the virus. It was the unknown quantity. Should we have locked down sooner, do you think?
No, we definitely shouldn't have locked down sooner. First of all, they don't work. I'm glad that you've already brought up Sweden. The problem with this report is it's 145 pages of opinion and it's not really evidence-based. So if you don't like the example of Sweden, what about Peru? Peru locked down very early and hard, and it's got the highest death rates per million. Actually, Sweden has very low excess deaths. Czechia also locked down very hard, very early, and has done much worse than us in terms of deaths per million, had much bigger subsequent waves. A peer-reviewed paper by Professor Simon Wood, who's a computational scientist from the University of Edinburgh, found that death rates, infections were falling before each of the three lockdowns. That's something that Chris Whitty acknowledged. He said the R rate was going down before the first lockdown. I don't know. Yes, OK, we can forgive political leaders for acting irrationally, perhaps in a crisis, but the time that you should look to your crisis management plans is in a crisis. This article that came out in the Sunday Times today calling Mark Warner, the data scientist who was with Dominic Cummings in a meeting with Boris Johnson, a genius, is a bit of a worry. It holds up this myth of the idea of the genius, the great man, but actually good decision-making is made by teams with quite a flat hierarchical structure, and you follow crisis management plans in a crisis. Now, pandemic plans have never recommended locking down because there is no evidence they work and they cause huge collateral damage. They may save some lives, although it does look from empirical evidence around the world that lighter measures and voluntary behaviour changes are effective, but they do cause harms. And this was foreseen. A veteran disaster planner I interviewed for my book, Professor Lucy Easthope, told me that when she was looking at excess death planning, that for every 2 COVID deaths, she would plan another 4 to 5 deaths from the results of lockdown. So, you know, from sepsis, missed cancer diagnoses, obstetrics, suicides, all kinds of causes. So this was foreseen, but all of those pandemic plans were abandoned in the teeth of the crisis, and that was the wrong thing to do. I just hope that cross-party report isn't any indication of the robustness of the parliamentary inquiry.
Now, Bharat, I know that you disagree with Tony and also with Laura about the efficacy of lockdowns. However, we can't we, Bharat, agree that lockdowns come at a price? Do you think we should actually not lock down again? Do you think it's something that should be ruled out in the future, given what we now know about their impact, the non-COVID death toll, the economic damage? I interviewed a professor from the University of Bristol that told me that this recession, the biggest recession in 300 years, could cause the early death of 500,000 people?
Poverty kills, we all know that, and this government, by its mismanagement, will have created poverty. I repeat, and I repeat all the time, which is you trashed the health plan, and in the process, you also trashed the economy. Don't give me this, that the economy got trashed because of the lockdown. The way you did your lockdown has caused the economy to be trashed. You have to own it. And with poverty, we know poverty, and the Tory party austerity, which was wholly unnecessary, has resulted in excess deaths. And now poverty, unfortunately, will also result in excess deaths. What we have to do is have the normal processes of making decision used, rather than a cabal of 3 people making a decision that we are going to go into a lockdown or not going to a lockdown. Prime Minister Johnson was not in favor of lockdown. And then suddenly, my understanding is, when Professor Ferguson from Imperial presented him with mathematical modelling data, there was an about turn that very day and things changed. That's my understanding.
Right, that was flawed data, wasn't it? 500,000 deaths were predicted.
That's mathematical modeling. And what we have always said is you need to engage with other people who are there out in the field, people like myself. I call myself shoe leather epidemiologist out in the field. What we needed were early control measures. And if we had had those early control measures, border controls, it's at the 11th hour that we introduced border controls, etc. If we had done all those early things, those people returning from northern Italy with their infections, which then seeded a lot of infections in the Brighton, southeast, London, southeast region. Those are the sort of things that we should have done and done better, done earlier.
Anthony Hinton?
To criticise in hindsight. And I wouldn't actually blame the government for the panic that they did and the initial lockdown. But you could actually see midway through April that you could work out from the peak of deaths to when the peak of infections was. And you could see then that the peak of infections had already passed at least a week or maybe 2 weeks before the lockdown started. With regard to Sweden, there is a table of deaths per million population. And Sweden now is number 52, way down that table, with very little restrictions, much of it voluntary. I visited Sweden twice to see for myself. And apart from things like restaurants stopping ordering at 10 o'clock and things, and a few restrictions on the numbers of people meeting up, there were no masks, there was no lockdown. All their children, importantly, were kept in school throughout. And I respect what Bharat says very much, and we agree on a lot. But you cannot have a lockdown without lots of consequences, I'm afraid. And we're seeing those now in cancer diagnoses that have been delayed. The hospitals are already filling up. My son worked in a hospital and was telling me his hospital was full and patients were being diverted. The ambulance was being diverted. I assumed it was COVID patients. But he says, no, it's not. They're all patients coming in with various conditions that should have been treated in the last 9 to 12 months that are now far more complicated. Things that would have been a short 30-minute operation and out of hospital in half a day are 2 or 3 hour operation and staying in hospital a whole week.
Bharat,
we mustn't forget this very important point, which is the National Health Service runs at almost maximum capacity. Then they took the decision to empty the beds and send elderly people home so that they could create bed capacity. And then we mustn't forget the messaging. The messaging was, we're busy with COVID, don't knock on our door. And as a result, my colleagues in NHS hospitals were all saying, where are all the anginas? Where are all the cerebrovascular accidents? Where are they? And unfortunately, this is tragic because this was bad messaging that don't disturb us. the hospital is busy with a crisis. That is where people have also died. We mustn't forget.
Laura?
Yeah, I mean, this cross-party report barely touches on the harms of lockdown. And, of course, there's still no cost-benefit analysis. I mean, just one thing, the word children is mentioned 3 times in the report, but the impacts of lockdown isn't mentioned on children at all. And the title of the report is Lessons Learned, but I think it's just still too early. It's still too early to learn the lessons. The report talks about groupthink being a problem in the decision-making back in spring 2020. But I think that the report's authors might still be under the sway of groupthink themselves. You mentioned the modelling mark. Well, the thing about the report and a lot of the discussion of lockdown is that we talk about lives saved in terms of lives forecasted by the simulated modelling. This is quite circular reasoning. It's fallacious reasoning. The model back in spring 2020 was an infection fatality rate of 0.9%. By autumn of that year, it was known to be 0.23%. And now, after vaccination, it's 0.96%. So that's just one of the flaws with the modelling. I think it's just too early to learn lessons, and it needs to be evidence-based. That report is really a string of opinions.
Final thoughts on this, Bharat Pankhania?
We will know. We will know in the process of time. But my final thoughts are, I wouldn't want to exclude anything, but I really would like decision-making not to be on the hoof, because lives matter. And when you suddenly refuse to lock down or lock down, but the decision was taken because 3 people met and panicked, isn't the way to govern.
Tony Hinton?
I think on that, myself and Bharat can absolutely agree. These should be properly made decisions. There was a proper pandemic plan that did not include lockdowns, that had been worked out over many years, and that was just superseded by the Prime Minister, Dominic Cummings, and his mate having a meeting without proper civil servants and other ministers being involved.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.